One day, a patient came to my clinic and his seizures were doing very well. And everything was good. He was on his medications, EEG was normal, and he was not having any seizures for a while. And then at the end of the visit, he was walking out and he kind of stopped and looked at me and said, "Doctor, can I ask you a question? But I'm embarrassed." I said, "Go ahead, why not?" He said, I have been having this problem with my erection and sexual function that has been going on for a while, and really no one talked to me about it. So he was like very hesitant. And I sat down, I started talking about this, and I explained to him, yes, this can happen. So we went back and reviewed all of his anti-seizure medications, and we found that one of the medications is known to cause sexual dysfunction. So we switched him to a different medicine and it worked. A few months later, he came back. He said that problem has resolved completely and he was happy and smiling afterwards. And this is a common problem that can happen to people with epilepsy, especially on anti-seizure medications, certain types. And no one talks about it and no one discusses. So today we'll talk about it in details. So epilepsy is much more than just seizures. It can affect many aspects of the patient's life. It can affect sexual desire, orgasm, fertility, menstrual cycle, pregnancy, and even the ability to have an erection and an orgasm at the end. So many patients unfortunately suffer in silence without discussing these topics with anyone outside, even to their doctors. We will discuss today these issues with men, with women, with women who and families who are planning to have children, and families who plan to not have children and wants contraception, and all of that we will discuss in details. And welcome, I'm Dr. Omar Danoun, an epilepsy specialized neurologist or an epileptologist, and here is the Epilepsy Encyclopedia where you find all the information you need to live a life of seizure freedom. So why does epilepsy affect sexual health? Some people say, well, seizures are in my brain. How does that have to do anything with sex? Well, it has lots of things to do with that because the brain controls all aspects of the body, and one of the important aspects is the hormones. So it can affect the hormones, testosterone, estrogen, progesterone. It can affect the ovulation, the fertility, sexual desires, and erections, and more. And in many seizures, especially the temporal lobe epilepsy, has issues with the networks that control these aspects of the human life. We can see it in many patients. So think of it as the brain is the CEO of the company. If they are sending the wrong messages, the whole company procedures and processes will be disturbed and affected. And seizures do the same. They disturb the connection between the brain and the reproductive system. And not just the seizures, it can be also the hormonal changes, and sometimes mood, anxiety, depression. They all have a role to play in why epilepsy patients suffer from some sexual dysfunction. So let's talk more about sexual dysfunction in men. The question is that can epilepsy cause decrease in erection and libido? The answer is yes. It can have multiple effects in decreased libido, decreased erection, impotence in some patients, reduce sexual satisfaction, and even infertility. I remember a gentleman who came to see me and he was complaining of erectile dysfunction. And then after reviewing his medications, we found that he has two issues. The first issue, yes, one of the medicine was interfering, but also the second issue was he was having low testosterone levels, which might be also related to anti-seizure medication that increase the processing of testosterone and releasing it from the body. So we ended up replacing the testosterone along with his urologist that we get to consult and co-manage, and change the seizure medicine, and things have resolved. So let's talk about these medications. So which anti-seizure medication can cause sexual dysfunction the most? There are multiple anti-seizure medications, especially the ones that are older anti-seizure medications, and they interact with the liver enzymes. And the most notorious one, and the first one that we talk about, is the valproic acid or Depakote. So valproic acid has lots of issues with sexual function. It can affect the hormones, it can cause lots of side effects on the body, and it can cause issues specifically with the sperm function and quality. It can decrease the motility of the sperms and decrease the quality and the function of the sperms, and even decrease the sperm number. All of these are issues that cause infertility. So this is a relatively new finding that we found that males can get affected a lot with valproic acid or Depakote, and now we started to avoid it as much as possible in people with epilepsy who we can put them on alternative. So that's in my clinic. I worry so much about that, and I had multiple patients kind of visit me just for that, to kind of switch them from valproic acid to other medications, people who had successful transition, and things will work out well. And the question is that if you get transferred from valproic acid to a different medication, how long it takes for these numbers to normalize. We think of it as something that is reversible in most cases. Usually the numbers of the sperm count and motility and all of that will return to normal within about 6 to 9 months, because the production of sperms is always active, and that happens a lot. So usually it is reversible. Of course, it depends from a patient to another. It depends on how long the Depakote valproic acid was used, the sexual health overall, and the age of the patient. Other medications can be carbamazepine or Tegretol. It is notorious for decreasing the sexual function by decreasing libido, decreasing the erection and erectile dysfunction, and sometimes can cause issues with fertility. So carbamazepine or Tegretol does have these side effects as well, because also it can interact with the hormones, because it is an enzyme inducer. It makes the liver function faster and flush out all the testosterone and other hormones. Phenytoin as well, or ipanotin, can cause sexual dysfunction and hormonal imbalance. Phenobarbital, the same, can cause sexual dysfunction and hormonal imbalance, and this is also an old anti-seizure medication, is one of the oldest actually. Topiramate is considered one of the new medications, or Topamax, but it also can cause sexual dysfunction, can cause decreased libido, orgasm issues, and it can cause also erectile dysfunction. Other medication like pregabalin or Lyrica and gabapentin, it can cause decreased libido, decrease sexual desire at all, and decrease ejaculation or orgasm. The good news is that we have alternative medications that are safer and have much less sexual dysfunction. If you think about, like, is there a medicine that is 100% clear, never happened before? Yes, there are some medications that were never reported, but everything is possible. And the safest medication in terms of sexual function are the newer anti-seizure medication. Lamotrigine, Lamictal is very good. Levetiracetam or Keppra is very good. And oxcarbazepine. However, sometimes the sexual dysfunction happens not because of the medicine itself, because of some other side effects. For example, like levetiracetam or Keppra, if you have watched the Keppra video, you will know that it causes psychiatric side effects. It causes depression, anxiety, mood changes, and that can be the cause of sexual dysfunction. And there are reports, and I have noticed in my practice and experience, that when you switch patients from older anti-seizure medication to a newer anti-seizure medication, the sexual function will recover and improve. Now let's have a switch gear in women, sexual dysfunction issues. We will come back to men as well, so just stay tuned. In women, they have been dealing with lots of other issues as well, like family planning, sexual function, sexual desire, ability to have children, pregnancy, menstrual cycle, and lots of other things like vaginal dryness and painful intercourse. And these can be caused by multiple things. Like men, it can be due to hormone imbalance, can be medication side effects, can be epilepsy and seizures themselves. It can be due to anxiety, depression, mood changes, and family stress. And many women say that, "Doc, I always have seizures around my period." This is a common thing. We call it catamenial epilepsy, when seizures happen around the menstrual period, and has lots to do with the hormonal changes and estrogen. We think about estrogen as a hormone that can induce seizures. It's kind of like gasoline is the estrogen, and the water or the firefighter is progesterone. So progesterone is the good guy, decreases the seizure. Estrogen is the one that can trigger seizures. And because the estrogen increases during the cycle, that can cause seizures. And there are 3 patterns. I explained all of that in details in the catamenial epilepsy video. I would like you to watch it as well, because it has all the details and how we treat it and so on. There are multiple patterns and lots of information. And the other thing for women is the pregnancy. There are medications that can affect pregnancy, like the worst medicine will be valproic acid or Depakote. It can cause issues with pregnancy, not safe during pregnancy. We try to avoid it at any cost. We try to give women of childbearing age medications that are safe. The safest medicine is lamotrigine, Lamictal, Keppra, levetiracetam and oxcarbazepine. There is a whole video about pregnancy. I would like you to watch it as well, but I just want to kind of give some highlights here in this video because it's an important topic. We always plan before pregnancy happens. We give women of childbearing age folic acid 1 milligram every day to have enough stores in the body, so if pregnancy happens, which happens sometimes unexpected in about 60 to 80% of the people with epilepsy. My patient when I see them in the clinic, she will tell me like, "Doc, I'm never gonna get pregnant. I'm not planning to anything." And then 2 months later, she will call me, "Doc, I'm pregnant." Oops. So this happens. So that is a perfect segue for contraception. So contraception of like prevention of pregnancy, we should know that some contraceptive medications interact with anti-seizure medicine. So combined oral contraceptive pills, the birth control pills, they can interact with anti-seizure medicine. So older anti-seizure medication like carbamazepine, phenytoin, phenobarbital, it will increase the processing of the contraceptive pills and makes pregnancy happen more. So it can cause contraception failure. It's important to know. And some contraceptives like estrogen ones will lower the lamotrigine levels. Also, it can cause issues. So there are some interaction. The best contraceptive method in epilepsy is IUD. And then after delivery, we do normal delivery, no need for cesarean section because of epilepsy. And then we recommend breastfeeding because breastfeeding is the most important thing you can do to help your child grow. Because studies have shown that children who have been breastfed are much more intelligent and have higher IQ in the same children that were not breastfed. So breastfeeding is very important, and almost all anti-seizure medications are safe in breastfeeding. So definitely breastfeed your children. So as you can see, there are lots of information that we have to put in consideration when we try to help with sexual dysfunction and to reverse and replace the medications. And we need to know lots of things in the background, knowing the type of seizures, type of epilepsy, any medical issues, and so on, so that we can switch the patient to a safer alternative that works and also is compatible with the seizure type. And this can bring us to the consultation. I offer now a remote consultation or a second opinion that you can book on. There is a link in the description below that you can book on a consultation. One-on-one, we will discuss and give you the best treatment plan. And many patients all over the world, from Australia, New Zealand, to Europe, to India, to the Middle East, everywhere in the world, even Latin America and some islands, had done lots of consultation all over the world. And it is very much, very helpful for people. And it is very satisfactory to me to help people all over the world. And feel free to book your consultation and we can see you next. And then other things that we can consider when we switch patients is that we like to switch them to newer medications that can have less side effects and more successful treatment plan. And then there are many issues when we discuss treatment for epilepsy. And one of the most important things is how to make the diagnosis of epilepsy correctly so that we can put the patient on this. And there is a video here. You can see that I made it 100% clear on how to make the diagnosis of epilepsy, what is the best testing, and how to treat it correctly so that you have the best outcome. And see you on the next video. Salam.